So here is when we can talk a little bit about the numbers. So what are the outcomes? And why I've been sort of hammering the topic about how important it is to get lung cancer screening. And here we can see those are two studies. I'm not going to get to bother you on the details. I'm just going to bother you with the numbers. That's what matters. When they looked into comparing a CT scan to a chest X-ray, there was 20% less deaths from lung cancer compared to a chest X-ray, which is very significant. It means in out of 5 patients that would just get X-rays maybe decades ago, now with the CT, we can actually save one of them, which is great. We hope to do better, but already great numbers. In terms of screening, we also can catch cancer at an earlier stage. We know that patients always fear hearing the words stage 4, which means that the cancer unfortunately has spread from outside of the lung and went to some other part of their body. However, with screening, we can actually pick up things at a stage 1, when it's a tiny spot on the lungs, that usually surgery or some focused radiation therapy might be enough to completely cure. This next slide is a little bit more on the medical side, so I'm going to take you to a little trip on how I look at information and how I look at scientific data before other oncologists like me, we can make all those recommendations. And here are those two studies, one of them called NLST, the other one called Nelson. And basically what this curve show is how much mortality is happening, how many deaths were happening from lung cancer. So the higher the number goes up here on the vertical axis, it means that more deaths have happened. And here we see a timeline. In orange, we can actually see patients that are what we call the control group, meaning those that unfortunately were not getting a CT scan because this was not the norm by the time these studies were done. You can see how early, in less than 1 year, we see the patients on the blue one over here, how many less deaths we see. And you can see that this difference keeps on going, meaning that those patients that got screening in both this study on the left and this one on the right, they had less deaths from lung cancer. So this is why it's so important.